Tuesday morning, and that means we turn to Dr. Isaac Bogos live to talk more about public health and infectious diseases. He is an infectious diseases specialist at Toronto General Hospital. Always good to see you, Dr. Bogos. Thanks for joining us this morning. So let's start here. You know, we talked about avian flu last week in terms of outbreak spread, and then, of course, that tragic human case in British Columbia. But then over the weekend, we heard about this case of bird flu being found in raw milk that was bought in from a store. So from what I understand, this means the milk from infected cows has the virus and it ended up in the milk. So, okay, a lot of questions here, but what are the worries? What are the lessons we need to learn here to prevent a similar situation?
Right. So this was in California. In Canada, we pasteurize our milk, and that's a big deal. If pasteurization can certainly ensure that the milk supply is safe and these pathogens won't survive pasteurizations. But in parts of the United States where they can legally sell raw milk, they found the virus in that product. That's a big problem. Raw milk, for example, can have a number of different pathogens, not just avian influenza. We know that it's a common source for E. coli and other bacteria like Listeria that can make people very, very sick, often causing gastrointestinal symptoms, but people can get broader symptoms from that. Avian influenza is a very serious illness. We know that it is an infection of epidemic and pandemic potential, and indeed it was found in the raw milk. And they, of course, are in the midst of a very large outbreak among their dairy cows in the United States. We don't have that outbreak among dairy cows in Canada, but it's an issue. And I think people should really think twice before ingesting raw milk if they have the opportunity. Pasteurization creates a much safer product, and that's why we're not all getting sick from raw milk.
Okay, that is certainly reassuring to know that our milk is all pasteurized. Dr. Bogos, in the meantime, let's turn to this. You know, next Monday, it's World AIDS Day. The change in this virus, you know, just in my lifetime, 50 years, is staggering. The amount of research, number of breakthroughs, remarkable. But could you help us sort of put all of this into context for us? Absolutely.
So, yeah, December 1st every year is World AIDS Day. It's a very important day, and it's important that we remember not just, you know, the tragedy of AIDS and how many lives have been lost, but also just have an up-to-date understanding of what this virus is now. And it's completely different now than it was 4 decades ago. It used to be a death sentence. There used to be no medications. There was a tremendous stigma. People didn't know much about how it was acquired. And then, of course, we learned a lot more about this today. And if we're lucky enough to live in Canada, which we are in 2024, people who are living with HIV can live long, healthy, happy, completely normal lives with a normal lifespan. And if they're on their medications, which or as little as 1 pill once a day, they don't transmit HIV to other people. The medications have completely changed this virus. So people, again, the biggest issues now are combating stigma, and you know, the stigma is still terrible. Some people have such shame and might not come out to get tested, and which is really awful. We need to lower barriers to care, lower barriers to testing, lower barriers to treatment. But again, people in 2024 live long, healthy, happy, completely normal lives. 1 pill once a day. They don't transmit HIV to anyone else. And this infection has been completely transformed.
Okay, a super quick question before I let you go then. Considering the advances that have been made in HIV/AIDS, is it possible that eradication could be down the road?
Yes, we actually have the tools to do so now. There's no reason for HIV to be transmitted anymore. We can prevent transmission for people at high risk with tablets who are uninfected, but it will prevent them from becoming infected. For people that are infected, we can give them a tablet a day and they'll live a long, healthy, happy life and not transmit others. We can block mother-to-child transmission. It would be lovely to have a vaccine. It would be lovely to have a cure, but this is we have the tools right now to eliminate this infection. We need the political will to get the drugs out to people who need them.
All right, Dr. Isaac Bogos, appreciate that. Let's end on that note, and we'll talk to you again next week. Thanks so much.
Have a good one.